The most common type of anesthesia used in surgery is general anesthesia, where the patient is rendered unconscious for the duration of the surgery. Used induction drugs include propofol and pentothal. There is often a question regarding the use of a mask for anesthesia. A mask is commonly used to administer oxygen just before or at the beginning of administering an anesthetic. Think of a mask as a means to an end. In some situations, the mask provides the pathway by which anesthetic is introduced. It is relatively uncommon that a mask alone would be used continually to administer gaseous anesthetic agents for the duration of surgery. Fortunately, the days of smelly, multiple-washed black rubber masks have gone the way of ether. In other words, they are of historical note and not of current concern.
That a mask will rarely be used throughout your surgery. You also know that with a general anesthetic, you are unconscious. The highest incidence of complications during anesthesia comes during gaining control of the airway. How then will you breathe?
The anesthesiologist can use several different methods. Sometimes the pathway for oxygen to get to your lungs is maintained with an oral or nasal airway. Upper action is not appropriate for people with certain anatomic configurations, so other techniques are available. Your anesthesiologist will assess your upper airway, jaw anatomy, neck extension, and other airway features preoperatively to best prepare for you. If a tracheal tube or an LMA is used, there is a foreign object in the upper airway during surgery under general anesthesia. These areas, the mouth, the pharynx, the trachea, are sensitive to even minor irritation. Who has not had the sensation of a pill being stuck in their esophagus after swallowing it? Additionally, anesthetic gases are often not humidified and as a result may dry out the upper airways. The sore or dry throat usually corrects itself within a day or two after surgery. At the end of the surgery, your depth of anesthesia will be gradually lessened as you transition back to awareness. The time it takes to recover from an anesthetic depends on the type of anesthetic used, the type of surgery performed, your health issues and medications, and to a certain extent, the length of surgery, among other things. With current anesthetics, there no longer exists a hard and fast rule that the longer the surgery, the longer the recovery.